Now, many of us have heard of the Mediterranean diet, of course, and our next guest believes that a lesser-known diet could be key to reducing blood pressure. It's called DASH, otherwise known as Dietary Approaches to Stop Hypertension.
Now, the diet is rich in vegetables, fruits and whole grains, and it limits foods that are high in sodium, saturated fat and sugar. Let's discuss this further with Jason Kovacic, Chief Executive and Director of the Victor Chan Cardiac Research Institute. Thank you so much for coming in this morning, Jason.
Thank you. Good morning.
Tell us a bit more about what this diet involves.
So the DASH diet and the Mediterranean diet are actually somewhat similar. The DASH diet has been around for almost 30 years now. And it was developed actually from the observation that vegans tend to have lower blood pressure and tend to be quite healthy. So it borrows elements of a vegan diet, but it's really translated that into a diet that I think is more palatable for most of us. So it's a diet that's rich, high in fruits and vegetables, high in whole grains. It actually encourages low-fat or fat-free dairy products and is high in legumes, nuts, kidney beans, lentils. But importantly, it's low in sodium, low in sugar, and low in processed and red meats.
Some would say that that is the normal healthy diet that we should be adopting.
Right, actually that's very close to that, and that's because this DASH diet, it was first published in 1997, and it has been the foundations of many of the dietary recommendations that we have in Australia and indeed around the world.
Well, why do you think it's not as popular as, say, the Mediterranean diet?
Right, so the Mediterranean diet has this sort of romantic notion that we're sort of living in the Mediterranean with a nice climate, sitting around under olive trees. The DASH has got this very medical kind of name, dietary advice to stop hypertension. And it's quite prescriptive in terms of how many serves you're meant to eat and so on. The Mediterranean diet, it differs principally that it encourages olive oil consumption and more fish consumption than the DASH diet, but otherwise they're broadly similar in terms of encouraging fruits, vegetables, nuts, legumes, whole grains and so on.
When you look at this diet as a whole, in the pursuit of better blood pressure, are you missing anything? So I know there's lower meat consumption in this diet, so are you trading off anything in this diet?
Yeah, absolutely. I think you're just trading off bad things for good things. Right. So I really don't think you're missing anything. Perhaps in menstruating women, iron could be a problem if you're not eating a lot of red meat. But really all the macronutrients and things that are essential for a healthy diet and healthy life are there in the Mediterranean and the DASH diets.
What would be the telltale physical signs, shall we say, you know, apart from going to the doctor and the doctor telling you, well, you're deficient in this, that or the other, what would be the physical signs that we may want to watch in ourselves to say that, well, we might be heading down that road of hypertension?
Right, so high blood pressure typically has no symptoms at all. So if we aim for a blood pressure of 120/80, so that's the systolic and the diastolic numbers. So if you've got mild to moderate hypertension, which a staggering number of Australians do have, that might be a blood pressure of say 140 or 150/85, there'll be no symptoms. When you get a blood pressure of 200/100, that's when it's usually a medical emergency. There's a pounding headache, blurry vision, nausea, vomiting, people that are critically unwell. That's a medical emergency. But for people with just modest elevation in blood pressure, which is incredibly common, there are no symptoms. And that's why patients are actually reluctant to take medicines because they say, I feel fine, why should I bother? But in fact, that high blood pressure is one of the most profound drivers of cardiovascular disease, stroke, heart attack that we have. So it's critically important to have these healthy diets, and also if people have got elevated blood pressure to see their GP and take the prescribed medicines.
So when you're talking about medicines, would this diet be something that you could do in place of that? Yeah,
potentially for a significant number of people, if they've got a suboptimal diet, the DASH diet can reduce blood pressure in the order of about 7 points of the systolic, so that's the upper number. It will reduce it about 7 to 8 points. Many people, though, if they're overweight, they might be drinking alcohol and other things that will drive blood pressure. They'll also need to take medications, but we've had blood pressure medications for decades. They've got an incredibly proven safety track record and they save lives. So these are not experimental things. These are proven, safe therapies.
You know, when we talk about diets, you know, we often think about limiting our intake of the fun things in life.
Right.
Sugar,
Sure,
chocolate,
and the holidays,
right?
Christmas is coming.
Exactly,
You're
yes.
right.
That is really difficult, particularly as you say, the holidays is just around the corner. How do you ensure that you're doing the right thing for yourself, for your body?
Right.
And at
so-
the same time, you know, not miss out on life.
Sure, sure. So these diets encourage increased intake of fruits and vegetables, and just to reduce the red meat and the processed meat. So I don't think that's a big thing. And of course, Christmas Day is special, and I don't think you can't be strictly medically minded for 365 days a year. But I think having those broad concepts in our minds is really important, because cardiovascular disease is the #1 killer in our society, and we all need to be doing more to reduce our risk.